Hello and welcome back to another episode of Rappin with the Rep. I'm State Representative Ken Gordon, and I'm real excited to have another great show lined up for you today. We've got two wonderful guests. We've got Jim O'Day. Representative Jim O'Day is the chairman of the Joint Committee on Elder Affairs. Welcome to our show.
Good afternoon.
And welcome back Marge McDonald from the Burlington C.O.A.
Thank you.
We're going to talk about senior services today. And many of you know that when I started in the State House, myself and other freshman legislators were asked to give a little talk about one of the issues that means the most to them, and I chose senior services during budget week. And the basis of my focus was on what's called C.O.A, which is the Enhanced Community Options Program, which helps seniors stay in their home a little longer, avoid going into a nursing home, and helps bring services to them. We were able to fund C.O.A to a much greater extent after budget week. And I wanted to ask you about some of the programs that that are in place to help keep seniors longer and some of the assistance they get from the state level.
Sure. Well, thank you. It's great to be here with you today, Representative. And I remember that speech that you gave, and it was really with assistance from you and other reps that allowed us to be able to add some additional funding to that C.O.A line item. And that certainly was one of the issues that so many advocates had come to my office to talk with me about prior to the budget cycle going into effect. And I was a new chair of the committee, so I found it very interesting in really getting to know all the issues that face seniors. And not that I wasn't aware of some of them, but they came at me fast and furiously during the first couple of months of taking over in the office. But C.O.A certainly it's a sort of a layered effect for those folks that are waiting, who may necessarily be eligible, if you would, to go into a nursing home, but really want to stay at home. So the level of care that they require is somewhat significant, and in order to maintain those residents in their home, we have to be able to be certain that we provide the kinds of services that allow for that to happen. And so with that C.O.A line item, with those additional fundings, we were able, and it really is it's a cost saver. Not that I want to look at things in that venue all the time, right? Why are we doing this? Because it saves money? Well, it does save money, but it also puts seniors much more at ease when they want to remain in their homes, right? So those seniors who couldn't necessarily be eligible to go into a residential facility, but with our ability to provide a much higher level of care for them and keeping them in their homes, that allows them to do that. And in the same breath, it allows us, for those individuals who haven't quite gotten to that level, to also be able to get necessary services. And so before that $5.5 million increase, there was a significant waiting list. And I'm happy to report today, and I'm sure you are aware of that, Marge, that waiting list, we still don't see that it's burgeoning again. So we're feeling good about that, but we do have to keep an eye on it.
That's great. And these are the services that will bring assistance to people's homes, again, so that they can stay there, and they'll help them to do things that keep them there, physical therapy and other types of things like that. Is that right?
Right, absolutely. We just this session, we've had some terrific bills being filed, and we've looked at a number of good bills that have been filed, and an act promoting equal choice in cost reduction is a bill that is currently in the financial services, healthcare finance committee. And this particular piece of legislation will do exactly that, right? It will allow, we hope, for 24/7, 24-hour services 7 days a week for folks still remaining in their home. It will allow someone's spouse to actually be compensated to provide the kind of services that are being provided that allows folks to stay in their home. And secondly, or thirdly, I should say, it's going to sort of broaden and expand the PCA involvement with individuals. So those, not only those with physical disabilities, but those that have cognitive disabilities without physical disabilities, we will then be able to have PCAs going into those homes and giving someone a reminder that, listen, you need to take your medication. You need to make sure that you eat today. So that is something that we've not been able to do thus far. So if you had that cognitive type of disability and you were unable to stay at your home because somebody couldn't come in and remind you to sort of take care of those needs, then what's the next step? Next step is into a residential facility, which, as we all know, is much more expensive. So we're hopeful that this type of, this bill, this particular piece of legislation will be enacted hopefully this session. And again, it's just one additional level of how we're hoping to be able to provide those great services that you're talking about and maintaining folks with dignity in their home.
And this is all ages, right? This is also for people who are over 18.
That's right, with
Right,
disabilities,
yeah.
correct, absolutely, yep.
Yeah, it's so interesting, and Marge, you must see this. I see it too when I visit some of the centers where you've got a spouse that's working, and if they could stay home, they could take care of some of these needs, but they can't. And so what's the result is that the spouse that needs the services ends up having to go to a nursing home or some other facility to provide that, where if we could give them a little help, it's cheaper for the Commonwealth, it's cheaper for the community.
And it's less of a strain on everybody's budget, so to speak.
And it's better for the dignity and the peace of mind of the family because they really want to stay together.
Yeah.
Right.
So these are some wonderful programs that are really helping people to live the lives as they get older that they've earned, that they want to live.
Right, and and what's been so exciting being in this committee is that you really have an opportunity to hear about all of the many different issues, right? We've had a couple of hearings, not necessarily hearings, but oversight hearings at the State House this year. And just for example, one of them was around the use of psychotropic medications.
Say that 10 times fast.
Yeah, no kidding. Medications on individuals in nursing homes, in residential facilities, who, for no other reason, are being given these medications really is in an effort to sort of maintain their emotions, if you would, right? But these are folks that there may be other ways of dealing with it, like perhaps adding some more staff, right, in the nursing home, right? So, there are just so many issues that are out there that we need to all be aware of and figure out how are we going to make certain that we don't let those kinds of things get ahead of us.
Actually, since you brought that up, if you don't mind for 1 second, one of the things that we're finding at our level is the mental health issue, which I'm sure you heard a lot about, and that there's not a lot of services out there. And so when there's no other choice but to put somebody into a nursing home because of their mental health status, and I'm not talking Alzheimer's, I'm really talking, resulting from substance abuse or other, psychotic issues or whatever, that they get bounced around, that they go to a nursing home and they can't handle them, so that they send them to the next nursing home. And within a year or 6 months, you've been to every nursing home with them, and there's no options left, and they end up back on the street.
Well, let me just tell you, you're ahead of your time, right? You're a trendsetter. But we are, before this session ends, we're doing a oversight hearing with the Committee on Mental Health and Substance Abuse around that very issue, around geriatric mental health.
Right.
Right, so we need to hear, because it's a huge issue, no question about it, and we want to be able to bring all of those folks together that have the insights and have the knowledge on, how do we prevent this, how do we work on engaging with our seniors so that we can, get at the bottom of these problems, try to make certain that we have therapy and counseling sessions available to them.
Great.
And really get it from the best practices.
Yeah, the last thing we want is a bunch of homeless 70-year-olds and 80-year-olds.
Correct.
And with the new boomers coming in, that's kind of where we're heading.
And you mentioned the Alzheimer's patients. And I know there's some work being done at the State House within your committees to try to address some of the needs of Alzheimer's patients, especially when they get into emergency rooms and things like that.
Yeah, I have to say that the Mass Alzheimer's Association are terrific advocates, for individuals who are suffering from Alzheimer's and, different levels of dementia. And there is actually a bill that has been filed that really is trying to establish a committee to look at what needs to be done, what type of special treatment do we need to be able to, in education, if you would, to provide to those professionals in acute hospital settings, like you mentioned, emergency room, for someone who comes in who either has been at home or who has been in a residential facility who is suffering from dementia or suffering from Alzheimer's, and that the change for them to go from their home, and think of it for yourself, right? Just for ourselves. If you go to an ER or have to wind up in a hospital, it's anxiety provoking.
Right.
So if you're someone who is suffering from Alzheimer's or dementia, there are absolutely reams of data out there that really shows that there has to be a special attention given to those patients so that their transition while they're at the ER or when they leave there to go back to where they originally came from can give them some sort of stability within that setting.
Marge, what else are you seeing? What are some of the needs you think the state can meet?
Believe it or not, we're seeing more drugs coming in. We're starting to see drugs being a real issue. 3 years ago, 4 or 5 years ago, I didn't have to worry about illicit drugs in the senior center, and all of a sudden, people are reporting to me that they're smelling pot in the bathroom, and that's becoming a real concern for people, is the substance abuse. We have boomers that don't think, not to bring up boomers as a group, but a lot of them have been smoking pot, their entire adult life and don't see anything wrong with it, and don't understand how any drug, illicit or not, will interact with their statins and their blood pressure meds and whatever else they get put on, and not understanding the risks of maintaining those drug habits over the years. And they think it's perfectly okay to smoke pot and to do those drugs that they've been doing all along.
Well, I haven't so much heard of that issue, but I'm glad you raised it today.
It's an up-and-coming issue.
Sure.
And then also, treatment for people, finding the treatment for people with mental health,
Right,
again,
exactly.
and substance abuse. It's a difficult one, and we're not trained for any of it. We definitely, I think, and that's where the state could help, is the training for those. How do we find them? How do we not diagnose it, but spot it? And then training on how to manage that and get those folks to get help.
Right. So I think the other issue too that I'm sure that you are aware of is the prescription medication problem.
Right in there with it, yeah.
Yeah, right there with it, and how that relates also to just the whole idea of so many seniors are on so many different medications, and when they do have to go for a hospitalization or some sort of assessment, to make sure that all that information about them is given to their care provider.
Including any illicit drugs, so
Yeah,
they know
including any illicit drugs.
that's
as
very
well.
important.
Positively.
Yeah, and there are seniors that are in a position where they've got to choose between the medications because they get so expensive and other things they need, food and their rent and things like that. So are there programs that we have in place to help them?
Well, there is another commission being established to look at health care as it relates to seniors, and how do we continue to try to make it more affordable, and really learn how we keep people, education, I think, around those issues that we just spoke about. And again, the whole healthcare issue is, we have to be able to do a better job of educating.
Yeah.
So when someone is 70 or 75, we hopefully gave them some information when they were 55 and 60 that they can utilize to help give them a better understanding of the problems that they may be facing, in their older years.
And in Burlington, the newsletter for seniors, actually, on your 60th birthday, that year, you will start to receive the newsletter. And it's not because you're old, I promise. It's because there's information about things about Medicare and open enrollment and things about retirement that are really important that we want folks to know before it's too late.
As far as protective services, and the flip side of when people stay at home longer, they may need more services, as they face issues that may create challenge for them that would bring in a protective services issue. Is there a commission that is involved with that?
Yeah, you're right on top of things here, Representative. But yeah, no. Last session, we were able to establish a protective service commission, which I'm happy to report that I'm one of the co-chairs with my co-chair of the committee, Senator Jalen. And we began meeting in December to discuss, so what are protective services? I mean, the list can be very long, right? When you first think about it, you would think about, physical abuse, neglect, those kinds of protective services, but the list is even longer than that, right? What we're talking about along with those issues is, financial exploitation of seniors, which can run the gamut from, a family member who may have a substance abuse problem and is taking advantage of their elderly mother, father, grandparent, uncle, or someone that has come to the senior's home and tried to convince them that they need a new roof, or any of those issues in between that. So on this commission, there are a number of professional folks involved with it, from the field of banking, from the field of financial services, from the district attorney's office, and I'm really looking forward to the release of our first sort of fray into looking at these issues, and really trying to come up with a concrete plan that will help and really establish some real guidelines for us to be able to tell our seniors about, and really try to give them some warning signals as to what you need to be aware of. Now, the one problem that I foresee, particularly in the areas of, when it's a family member taking advantage of a senior, is this whole unwillingness of the family member wanting to, bring charges against anybody within their family. So if what we've sort of started talking about is looking at that in the same sort of light that you look at a domestic violence situation where you have a victim who doesn't want to press charges. And I think today the district attorneys and the attorney generals have come to a place where even without the victim's complaint, you can still bring forward charges. And I think that is an area where, certainly sometimes competency can be an issue, but, when somebody has been outwardly physically abused and they don't want to bring, or fiscally exploited, and they don't want to bring charges, that we have to have some ability to have leverage in doing that. Now, I don't know exactly how that's going to look when we're finished with it, but those are the kinds of conversations that we're having.
Yeah, this may be something where we have mandatory reporters in some of the domestic issues. A doctor sees some of these signs and has to, consider the options.
I think it's important. I mean, we have seniors that don't want to hang up on people that are trying to scam them because they don't want to be rude. Right. So you're not going to find them pressing charges against somebody they care about.
And in the world
or that they know.
Right, and in the world of the internet, right, everybody, well, I shouldn't say everyone, but many of our seniors have the computers at home, and they get into some sort of, dialogue or conversation with someone on the internet who knows where they are.
That Nigerian email.
Right, and, you just, and you've probably seen it probably more than I have, but when you hear the heartbreak of a senior who says, my life savings, my $30,000, my $50,000, my $12,000, my $9,000 that
I've heard of
saved,
$100,000 or $200,000.
$100,000, it's all gone because of some scam that they found themselves getting involved in. So I really think that we have an obligation to really work on that as an issue, to make sure that our seniors, really are protected. From that kind of a scam.
Communication and education is so important. I know my mother has told me about a scam that's going around where she lives in Florida, where someone calls and they pretend to be a grandson or a nephew.
That's a popular one.
Yeah, please send me this money. Don't tell my parents because I'm in trouble or something like that. And some people fall for it if it's a distant, geographically distant grandchild. Right. And just bringing it out and talking to it together. These are, this isn't the first time this call's been made. So having that opportunity to talk about these things are important.
Right, and you really want to make certain that our audience understands that no one is suggesting that you're not able to, kind of keep an eye on yourself. Nobody is saying that, but in an instance where that may be an issue, right, that we should have a layer of protection so that, we can step in or someone can step in and say, listen, this just isn't okay. And the problem is, if you don't catch it beforehand, once the money's out the door, right, it's more than likely not coming back. So again, the education, the component of all of this, the talking about it publicly like we're doing today, I think really at least puts the idea in people's minds that it's wise to try to be as on top of things as possible.
Right, because as you say, no one's going to talk to someone and say, well, let's talk about who you talked to last week. On the other hand, someone coming into the Burlington C.O.A. And addressing the variety of things that have been known to be out there so that people can be a little tuned in when they might hear about one of these scams and then realize, you know what, maybe this isn't what it appears to be.
I actually talk about it a lot in the newsletter, and I will always say, because I can't address every single scam. I mean, my entire newsletter would just be nothing but scams. But I always remind people, don't give out your basic information. Don't give out your social security number. Don't give out your date of birth. If you haven't actually made the call and initiated the call, you shouldn't be giving any information out. And you can always ask for a phone number to call back or ask them to mail you the information, and that's at the point where they will probably hang up on you.
Right.
So.
Yeah. Now, I read a little bit about the Elder Economic Services Commission.
Yes.
Can you talk a little bit about that?
Sure, absolutely. Again, we have many seniors at a variety of different level, places or stages in their lives, right? Where are they? How old are they? How much money do they have? When's the money going to run out? And how do I get from age 60 to whenever the end might be? So, I've sat in on a number of different roundtable discussions on this particular topic, and again, it's one of those things where it just becomes a lot bigger than I ever could have imagined. The need for having this type of commission. We have folks that are 60, 65, 67 years of age who may not be currently employed but still very much want to be employed, and they need reemployment, retraining. I will say that coming up this Thursday, there was a transportation hearing for a variety of folks, but in this particular situation, we're going to be talking about seniors and those who need to have the opportunity for transportation to get them to a job or to a place to shop, to get their medicine, to get their week's groceries. So the issues just continuously overwhelm me as the chair of the committee, so I can't imagine what it does to someone who is facing those issues. So hopefully this commission is really going to be able to look at how do we make certain that our seniors have that stability, have that peace of mind, that they will feel as though they're going to be able to take care of themselves, house themselves, feed themselves, and keep themselves stable in their own environment over the next 20, 30 years. And is there going to be employment opportunities for them? Are they going to have to work longer than they anticipated working? There are some discussions going on that we're going to be dealing with this week around health care benefits for retirees, right? For state-employed retirees, and what was told to them 20 years ago, what they're being told today, and how that may impact them 10 years from now. So, those are real issues, right?
Right.
Serious issues that they felt when they signed the dotted line, so to speak, to become a state employee, that they were going to be covered with their health care for the next 25 years. And now there's talk about it being cut in half, talk about it not being there at all. So, that's
going to be a fun subject.
Yeah, that's an economic stability issue, right? Clearly.
It is.
So.
But yes, you mentioned the transportation, and Marge, as you know, that's an issue that's so important in Burlington and in Bedford. Because
Well, and
as you
nothing
come
will
out-
make a senior dependent faster than not having transportation.
Right.
Yeah.
Right.
And not that it's the next step, but if you can't get out and move around and do things and be independent, the next thing you know is you're sick, you're in the nursing home.
Right.
So it's much less expensive to have the transportation out there and available to them. And most seniors don't want the door-to-door car.
Right.
They want to be able to have more public transportation where they're in control of when they go and where.
Right. I mean, public transportation is a huge issue, and it's one that we have to continue to keep on that front burner. And,
Yeah.
and I know it sounds like you're very much of an advocate for that. So
I try.
I'm sure you and Ken will be working diligently on that issue.
The issues that face the ride and the
Oh, yeah.
increase in fares are important. They hit
Yeah.
seniors hard. as you know, and we've got to find ways to get people so that they don't feel isolated.
Right.
Especially if they're, a surviving spouse, they may be living alone, and then all of these other issues creep up as far as, that they become involved with. So these are all important to us.
Yeah, you hear the phrase quality of life, right? And I really hate to trivialize that phrase, but it really is what I think our jobs are all about, right? Is making sure that the quality of life for our seniors is such that, they have a quality of life, that they're not prisoners in their own homes,
Right.
that they're not having to skip one thing or another, whether it's by medication or eating. So we have a lot of work to do on
Yeah.
this issue.
And we know that seniors worked hard for us.
Positively.
Yep.
And,
It's the least we can do.
That's right. That's absolutely right.
Absolutely.
Well, I appreciate you coming on. Are there any other issues that we haven't touched upon that, before we close?
No, I just appreciate your willingness to continue to talk about such important issues here in your town, or in your district, I should say. And you're very fortunate to have such an involved director of the Center on Aging here with you. And,
Thank you.
It's terrific to have folks willing to talk about these topics. And I'm just looking forward to continuing to do my work as the chair of the committee.
Well, I appreciate your leadership on those issues. And Marge, I've appreciated from the moment I started working at this job, you reached out to me and got me involved with some of the issues that you're faced with at the Senior Center.
Well, thank you for getting involved.
You're welcome. Is there anything that you want to add?
I think
before
one of
we
the things I want to add, because
Yeah.
a lot of people will be angry with me if I don't mention it, is affordable housing for seniors. And I'm not talking housing authority, 30% of your income. I'm talking basic affordable housing that, at least in this area, isn't $2,000 a month, for a one-bedroom apartment. I know that there's other parts of the state where it's much cheaper, but a senior in Burlington doesn't want to go out to the western part of the state to live, and that's not going to be quality of life. A lot of apartments are unaffordable, in this area for seniors. But number one, there's not enough housing, state housing. But number two, there's not enough housing that's affordable for them. That's going to be $1,000 a month or $800 a month in that area for them. So, and that's another really difficult topic. And
Well,
Go ahead,
no,
Jim.
go ahead.
It is a complex issue, and we could certainly, in fact, it's a great idea, and then maybe our next episode we'll talk about housing. But it's a complex issue because with the problems that face the federal government and our state budget, we try to address these as best we can. Any thoughts on that?
Well, no, I mean, you hit it on the head. What I will say real quickly is we're going to have a governor's race coming up, right? I think all of our seniors and all those that advocate for our seniors need to make sure who is telling them what they're going to do as it relates to our senior population, and really listen to what it is they have to say.
can I add, for the seniors, you need to not rely on the advocates to do the advocating.
Right.
It's in the numbers, You want to have those phone calls going in. Sorry, guys.
No, that's fine.
You want those phone calls, to the governor's office, to your reps, so that they know how many people are really concerned about the issues that you're worried about.
And you're absolutely right about that, Marge. I mean, democracy is a wonderful thing, and we have choices that can be made, and it's important to make them. Well, everyone, thank you again for tuning in to Rapping with the Rep. I'm State Representative Ken Gordon, here with Chairman Jim O'Day and Marge McDonald from the Burlington C.O.A. Thank you, and we'll see you next time on Rapping with the Rep.